exercise is being funded by the World Food Program through a letter of understanding that they have between the Ministry of Gender, Children and Social Protection and the Ghana National Household Registry for that matter. We estimate a total of over 50,000 individuals in the different vulnerable categories that will be profiled within the Greater Kumasi and Obuasi areas. The areas have been zoned into 4 thematic areas and hotspot zones, since it cannot be exhaustive of the numbers that we are looking for. And this will be based in the Kumasi Metro, Asukore Mampong, Swame, Asukwa, Obuasi Municipal, and then Obuasi East. As you are aware, the outbreak of the novel coronavirus pandemic, codenamed COVID-19, led to the government of Ghana locking down some key areas, and it was Greater Accra, Greater Kumasi, in April last year. You know that critical to the lockdown process was a thorough risk assessment. Government had to take into account the health and socioeconomic implication of the lockdown involving millions of people whose socioeconomic status had dwindled and their level of poverty had dipped. And this therefore exposed them to food insecurity, difficulty in accessing basic healthcare services, and other hazards. Consequently, the Ministry of Gender, Children and Social Protection put into immediate effect an emergency social protection system to safeguard the poor and the vulnerable. Because in times like this, when people's livelihood have been destabilized, people's earnings and income have gone down the dip, then it becomes very, very crucial for us to know that the poor continue to go down the line. It's critical to realize that we managed to collect data in the Greater Accra, but had to use some sources of data from our partner Social Welfare Department and other data that was gathered by the ministry as far as the Ashanti region was concerned. With the daily rise in COVID-19 infection and its effect on the poor and vulnerable, it has become extremely expedient for us to do a rapid data collection in these same areas that was designed last year with the kind support of the World Food Program, the UK Aid, and the World Bank. Key to a successful, productive social protection program is the need for comprehensive and robust data. One of the things that this coronavirus have exposed us to is the inadequacy of data and then the ability to be able to target rightly. And the Ghana National Household Registry is a unit whose purpose is supposed to be the targeting center, creating a single national household data so that beneficiaries of social protection programs can draw from it. So the more we are able to pick data, the more we enhance the capacity to improve upon the efficiency in targeting, improving upon transparency, and also ensuring that these relief items get to the most targeted people. The Ghana National Household Registry, whose mandate is to create a national household register over the year, has demonstrated robust system to gather data using electronic method of enumeration. And I must say that through the support of the World Bank, we have created electronic enumeration system with data collection equipment, which makes a turnaround time to be so fast that we're able to pick rapid data. We're able to pick over 80,000 vulnerable persons in the Greater Accra region within a matter of a week. And this data has since been used by other agencies, including the World Food Program, to target over 70,000 vulnerable people. These are culminated in a similar exercise to be undertaken in the Greater Kumasi and Obuasi area. We realized in that data gathered that over 60% of the vulnerable individuals slept in kiosks, containers, markets, uncompleted structures on the street, lorry stations, chop bars, and drinking spots. So this is not going to be different from the data that is going to be collected here, because typically these are mobile people who do not have places of residence and they are in the streets, i.e. people in the very vulnerable category. Ladies and gentlemen of the press, please permit me to also take the opportunity to shed some light on the activities of the GNHR. The registry is a unit under the Ministry of Gender, Children and Social Protection with the mandate to create a single national household register so that there will be a common mechanism of targeting. There have been duplicity as far as targeting beneficiaries of social protection is concerned. So there was a need for there to be a common mechanism so that you have that kind of uniformity in targeting. And that's one of the cardinal mandates of the GNHR. The development and compilation of such a register involves collection of information on the composition of socioeconomic characteristics of households, When this register is completed, it serves as a database for the selection of the poor and vulnerable. As I said, this tends to improve upon targeting. So far, GNHR has successfully collected data on households in the northern, savannah, northeast, upper west, and upper east regions. The various MMDAs in the upper east, west, and northern region are using this data beyond social protection for their medium-term development plans. NGOs in these areas and civil society organizations are leveraging on this data. The recent spill of the Bagri dams had we getting Volta River Authority and some other agencies using this data for targeting. I must also say that the main use of the data in our flagship programs such as the LEAP and the LIPW are drawing its beneficiaries in these areas such that targeting is based on science and data. This has greatly improved upon the livelihoods of many. This process enhances transparency and also the possibility of, without bias, not missing any vulnerable group of persons. With this support today that we are receiving from the WFP, culminating in a support they've already done with over 75,000 vulnerable persons with catchment areas in Greater Accra and Ashanti region, they are going to help us to pick up this data starting from this week. The beneficiaries will be identified by the GNHR data aligned with poverty and food insecurity indices. The beneficiaries shall consist of 60% female, 40% male. We are not moving away from the LEAP model that is being used. The same model shall be used, but this time around, to be able to adhere to other protocols, the use of MOMO or the use of mobile money transmission system will be the method to be used, but the ministry will still align with the LEAP methodology. In line with government's drive to improve the living conditions of all Ghanaians, especially the extremely poor and vulnerable, the scope of the Ghana Productive Safety Net project, in which the Ghana National Household Registry is under component 4 of that project, envisions a restructuring that ensures that the provision of emergency cash transfer to extremely poor and vulnerable persons' households who are not on any social protection programs but are hardest hit by COVID-19 are assisted. The program is targeted at over 160,000 specific groups of people across the country: homeless persons in Accra and Kumasi, persons living with disabilities, alleged witches, persons affected by floods, and other extremely poor persons in the poorest regions of Ghana, that is the northern region, northeast, savannah, upper east, and upper west region. It is important to note that only persons confirmed as poor and vulnerable by the Ghana National Household Registry will be deemed eligible to qualify for any assistance. There shall therefore be a mop-up of this data collection exercise for an extra 20,000 households to be funded by the World Bank in this direction, so that we can have a comprehensive lot of the number of vulnerable categories that we are looking at. On our database as of now, we have a total of 184,125 households in Upper East region, with a total membership of 1,066,812. Upper West, we have 137,565 households, and then a household member population of 618,378. In the same way, in the Northern region, we have 306,802 households, and then we have household member population of 1,467,007 and 7 members. Northeast 91,740, and then the household members 535,888. So in total so far, GNHR, as far as the household data collection is concerned in the entire country, whilst we plan to move into other parts of the country, is 812,423, and a total of 4,223,985 member population. We have also been able to pick comprehensive data of 665 alleged witches in the northeast and in the northern region, and all these people have been granted emergency leave support, and they have been put on the leave by kind courtesy of the minister, the government, and the World Bank. We have also been able to pick 80,000 data of vulnerable persons in 13 districts in the Greater Accra region. We are so much grateful to the World Food Program, on whose platform we can draw on this data for their support. We have a letter of understanding with them, and we are working to be able to extend this support to the vulnerable, and also to the UK Aid and the World Bank for additional support to enable us to upscale the numbers we are looking for as far as the table is concerned. This week, we are starting the data collection activity by this press briefing today. And so that's an activity that has already started. A courtesy call was being done as of the morning by the technical team with the operations team to go into the regions and then move into the districts and the municipalities by way of community entry for them to know the activity that is about to take place. And so as from tomorrow and Wednesday, the communication team will deepen public information campaign in the hotspot areas, which I have already spoken about. Zone A around the Asafo Railway, Zone B, the Moshizongo area, Zone C, the Asokore, Ofori Krom. I think that we've made these areas available for you, the media. And one of the things we will also do on Thursday is to train the enumerators who will be undertaking this exercise. It's purely computer-assisted personal interviewing. So they are going to use tablets to do this, and the data is going to sync in Accra in real time. They are going to adhere to the protocols. They will have all their marks and all the other protocols that are supposed to be done. This activity is supposed to take 2 weeks, and we expect that there shall be an end of data collection by February 23rd, Friday, February 23rd, 2021. So I'd like to thank our funding agencies. I want to thank the ministry, I want to thank the chief director, and I want to thank you, the media men, and then the World Bank, the UK Aid, and then the World Food Programme for making this to happen. Thank you very much.